Hi guys, welcome to Healthy Living with Nosmo, the channel where health finally makes sense. Welcome to this series, and in this series we will be talking about epilepsy, the facts. Last week we talked about the myth versus the facts about epilepsy, but this week we want to look into the facts. Did you know that epilepsy has been known to be one of the most common neurological disease worldwide? Yes, because over 50 million people are living with epilepsy. Nearly 80% of these people living with epilepsy live in low income and middle income countries. Yes, and about 5 million new cases are diagnosed every year. And the risk of premature death is 3 times higher in someone with epilepsy. And this is why epilepsy is one of the world's most common neurological disease. So let's unwrap this. Now, let's look into the causes of epilepsy. Epilepsy is caused by an abnormal electrical activity in the brain. Some causes remain unknown in about 50% of epilepsy worldwide. However, these are some of the causes of epilepsy. The first one, bed injury. Bed injury or lack of oxygen during delivery. Okay, so a lack of oxygen during delivery can lead to epilepsy. Okay, now the second one is severe head injury. Severe head injury, maybe a fall happened or an accident happened, and it affected the brain somewhere, it can cause epilepsy. Now, stroke is another one that can cause epilepsy. Remember, we did talk about stroke a while back, and yes, it can cause epilepsy because, again, it affects a part of the brain. And if it affects a part of the brain that sends signals, then it can cause that electrical abnormality in the brain, okay, leading to epilepsy. Brain infections such as meningitis can cause that, okay. Brain tumor, if a person has brain tumor, it can lead to epilepsy. Okay. Now, genetic conditions can also cause it. It can be passed down. If it's in someone's family, if it's hereditary, then it can also be passed down. Genetic conditions can cause that. Okay. So, those are the causes of epilepsy. Again, bed injury or lack of oxygen during delivery, stroke can cause it, severe head injury, brain infection like meningitis, brain tumors can also cause epilepsy, right? And genetic conditions can lead to epilepsy. Now, let's talk about the impending feeling or the aura, which is also like a warning sign that people get when they're about to have a seizure or an epileptic seizure, right? So let's talk about that. What happens before that seizure? People who have epilepsy will tell you that they can feel when it's about to happen. Okay, it's called an aura or warning signs. Now, but not everyone experiences this aura. Okay, some it just happens to them and they don't experience that aura. Now, the first one is there's a sudden fear or anxiety that comes with just about to feel that seizure, about to have that seizure happen. So there's this fear, there's this anxiety that just comes, and they know that it's happening and they know it's about to happen. And that kind of helps to prepare them, okay, for what to do within their environment. So some people already know when they feel that they're about to have it. A second one is strange smell or taste. Some people have a strange smell or they have a strange taste feeling in their mouth or in their nose. They could just tell that they're about to have it, and that's just their own. Okay. And like I said, not everyone feels this warning sign or aura, like I call it. Dizziness is another one. Dizziness is another aura before a seizure. Some people will feel dizzy before it comes, and that's how they know that they're about to have a seizure. Tingling sensation. A tingling sensation can also happen. The brain can be sending signals to some parts of our body saying you're about to have it. And some people get that tingling sensation, and it's different for everyone. What one person gets might be different from what another person gets. Okay, so and another one is vision change. Vision change, it can get blurry. They might begin to, see different things, and that kind of tells them that they're about to have a seizure. Confusion is another one. Confusion. Some people start getting confused. They're wondering what's going on around them. It's one of the aura or before the seizure. It's one of the aura before the seizure. Confusion can be another aura before a seizure happens. So these are signs to look out for in people who have epilepsy, and that's a way to help them prepare them for what's about to happen. So if you have a friend, a family, someone that you know, these are signs to kind of help them to, as a support system, to help them to know, okay, you're about to have a seizure. What do we do? How can we help you? How can we support you? How can we make sure that the environment is safe for that person? Okay. Confusion, like I said, deja vu feeling, that feeling of deja vu, like this thing has happened before, or I've experienced this before. It's a situation that's repeating itself all over again. That deja vu feeling, some people get that before the seizure happens. Sudden headache. Sudden headache is another aura that can be felt before the seizure happened. Sudden headache. Okay, so you see that there are a list of things that can happen before a person feels this, gets a seizure attack. Okay, so they can prepare themselves ahead. So some people already know, once they feel that, they start preparing their environment to make sure. So in case it happens, it's safe. It's a safe environment, and they don't harm themselves in the process. Now let's get into the types of epilepsy. Okay, I'm going to break it down so we can understand the types of epilepsy. Epilepsy is categorized based on the types of seizure that is experienced and their underlying causes. And the first type of epilepsy is a focal epilepsy. And this type of epilepsy affects one part of the brain, just a particular area in the brain. Okay, but it can also be divided into two. The first one is a focal aware seizure. Okay, it means that that person is aware of what's going on. If they are conscious when they are having a seizure, okay, but they'll just experience some unusual sensation. Like I said before, like I said, the aura that they feel before the seizure happens. So the focal aware seizure is when the person is conscious and they are aware of what's going on, and they can feel some sensations, some emotions, or some movements that's about to happen. Now, the other type of focal epilepsy is focal impaired awareness seizure. A focal impaired awareness seizure. This means that the person loses consciousness. Okay, their consciousness is altered, and the person may perform some repetitive movements. The person's consciousness is altered, and they may perform some repetitive movements like smacking their lips and gesture when they're about to have that seizure. The other type of epilepsy is called generalized epilepsy. This type of seizure, they often causes loss of consciousness. Now, the first type of generalized epilepsy is absence seizure. And that absence seizure is like daydreaming. Okay. So they're not aware of what's going on. Okay. When they're experiencing that seizure, they suddenly lose awareness of their surrounding. And it's like a person daydreaming, and they come back to realization of what just happened. But that brief moment, they've lost awareness of the fact that they had a seizure. So it's like absence. They're absent in the mind. Okay, so it's like daydreaming. That's an absence seizure. So if you see someone who's having that, that's a type of seizure. Okay, and it's a type of epilepsy. The second one is tonic clonic seizure. A tonic clonic seizure. And I'll break down the two names, tonic and clonic. Tonic just means that there's a stiffness of the muscle, a sudden stiffness of the muscle. Okay. And then that clonic is like a reaction, like a jerking movement. Okay. So tonic is a sudden stiffness of the muscles. Okay. And so they're like, and then clonic is like they are having a repetitive movement. Okay. It's followed by a rhythmic jerking. Okay. Movement, which is the clonic part of it. So tonic clonic seizure. There's a sudden stiffness of the muscle. And then after that, there's a rhythmic jerking of the body. Now, there's the next one is called myoclonic seizure. A myoclonic seizure, in this type of seizure, muscle twitches suddenly with brief jerks or twitching. Atonic seizure. An atonic seizure is when they have sudden loss. they lose control of their muscles due to the loss of muscle tone. So that's atonic, because remember that tonic means that there's a sudden stiffness of that muscle. But atonic in this part, they lose control of that muscle, okay, and they lose control of their muscle tone, and that can cause the person to collapse. Let's talk about the combined generalized and focal epilepsy, meaning that remember that focal is just one part of the brain, it's affecting a part of the brain, but in some people it can start off with affecting a part of the brain and gradually go into affecting every other both parts of the brain, the both hemisphere of the brain, right? Every other part of the brain. And so they start off, you know, with focal, and then it spreads, okay, to involve the entire brain. And that is where we talk about the generalized. Another type of epilepsy is reflex epilepsy. The reflex epilepsy, and like I said before, is that some people experience reflex epilepsy when there's a flashlight, like a specific stimuli, okay, like a flashlight, a certain sound, their environment can stimulate them to the point where they have an epileptic seizure. Okay. Let's discuss the treatment of epilepsy. 70% of people with epilepsy can become seizure free with the proper treatment. Main treatments of epilepsy include medications, anti seizure medications, surgery. Okay, for some patients, they can have surgery. And I'll break all of these different treatments down so that way we can better understand and have informed knowledge. Lifestyle management as well. There's nothing that we do that we would not involve lifestyle management, especially when it comes to our health, because that's like always the easiest way to go about managing a condition before the medications and the invasive procedures. Psychosocial support is another treatment. So we have anti seizure medications, surgery, lifestyle management, and psychosocial support. Many people can eventually reduce or stop medication after years without seizure under medical supervision. First treatment is anti-seizure medications, and oftentimes is always the first line of defense, always the first line of treatment. Okay, and this medication is works by calming the abnormal electrical activity in the brain. That's what the medication does. So it helps to reduce and calm that abnormal electrical activity and signals that are sent in the brain. Okay, and about 70% of patients achieve seizure control under this type of medications. Okay, next treatment is surgery. Now, this surgery is most of the providers or doctors only recommend this when maybe the medication is not working and is not helping to reduce and control the seizures. And that is when they will propose a surgery. Okay, so for patients whose seizures do not respond to medication, this is when the doctor would say maybe we should do a surgery. And in this surgery, they remove the specific area where that signal that's causing the seizure. They remove that specific area of the brain causing that seizure or sending that signal. Okay, and once they take that out, it reduces and takes away the amount of seizures that a person will have. Okay, so they take that out, and that may be an option for someone if the medications are not working. But if your medications are working and is helping to reduce the seizure and calm the person, then that's one way to go. But if it's not, you can look into the option, discuss with your doctor, discuss with your provider, and see what options are available to you when it comes to surgery. Guys, they have devices which are called neurostimulations. Those devices are neurostimulants. Okay, what they do, they implant these devices that send mild electrical signals to the brain to reduce the seizure. So it's like putting in something that counters the seizure, the electrical activity, abnormal activity that's already in the brain. But this one is already, it's just to send a mild electrical signal to your brain to reduce seizures. Remember that when a person with epilepsy is already having an abnormal electrical activity in the brain, but when they put in a device or they implant this device, which are called neurostimulants, right? Neurostimulation, it is to reduce the seizures. It also sends mild electrical signals to the brain to reduce seizures. and it usually works alongside with medication. This is mostly taken with medications as well, and so that it can help to manage and control that seizure. And the other type of treatment is a lifestyle management. A lifestyle management, again, remember that our daily habits are very important to our health, and the health conditions that we're facing is very important, that our daily habits have an impact on seizure prevention. Okay, they're very important. Now, consistent sleep is very good. A person who has epilepsy should get consistent sleep. Okay, get a quality sleep, consistent sleep schedule. All right, stress management is another one. They have to learn to manage stress. They cannot be around stress because that could be a trigger for some people. Like I said, we have reflex epilepsy, and that can be a trigger for some people with epilepsy. Okay, so managing their sleep schedule, managing their stress level is very, very important. And avoiding any triggers like excessive alcohol, missed meals are also vital. So it's very important that people who have epilepsy take care of their health. They're getting good sleep, they're eating good food, they are resting properly, they are avoiding anything that would affect them emotionally, mentally, and stress them. Any environment that would add more stress can trigger epilepsy seizures. So, psychosocial support is another treatment. Psychosocial support is where the people with epilepsy are getting counseling, they are getting therapy, they're seeing people to be able to manage the emotional and the social impact of having epilepsy. Because we all know that the society, especially in low and middle income countries, already have this notion and this norm about epilepsy. Okay, and this stigma and discrimination is very high in those environments. Now, living with a chronic condition can be very challenging. Okay, so counseling, support groups, therapy is very important to help people living with epilepsy manage their emotions, okay, and the social impact of having this condition. And then therapies like cognitive behavioral therapy are used to help to manage anxiety and depression. Okay, there are support groups for this. There are therapies. You see, some people see therapists if they have access to it. I want to specifically discuss on the ketogenic diet because different studies have shown that this type of diet can help with the management of the seizures. Okay, studies have shown that ketogenic diet for epilepsy has helped to manage the seizures. Now, the ketogenic diet for epilepsy is a meal plan that generally is high in fat and low in carbohydrates. Okay, high fat, low in carbohydrate, and is designed to manage the seizures. Okay, it's important that you speak to your doctor and say, hey, is this an option for me? Would this really help? Because again, you need to be speaking to your doctor, a dietitian, to be on this type of diet because it does come with its own risk and side effects. It's important that they discuss with their provider, discuss with your doctor, discuss with a dietitian before you go on this type of diet to make sure that you're being monitored properly. Okay. Your provider may recommend dietary treatments if you aren't getting the results you hope for from the anti-seizure medications alone. Okay. Now, a keto diet is an option when seizures aren't managed with the medication. Okay, they will recommend keto treatments for children who have epilepsy and even adults, including infants who have epilepsy. Adults with seizure conditions or epilepsy can also participate in this keto diet. Okay, now how does this keto diet help with epilepsy? Let's talk about it. When a seizure happens, right, the nerve cells in the brain send signals uncontrollably, right? And that's why it's firing signals, and that's why they're having the seizure attacks, right? Now, it takes a lot of energy for the brain to do that. So, what we want to do with keto diet, right? What the keto diet does is that it controls the amount of energy, because again, carbohydrate is what is giving us our energy. So we want to have low carbohydrate and we want to have high fat. Okay. And studies suggest that changes to your metabolism may affect how energy is being used. Okay. Or the amount of energy available to those neurons that are sending those signals to the brain. Okay. It takes a lot of energy for your brain to send signals. When you're on a keto diet, it affects the amount of energy that your brain has to be able to produce those signals, and that reduces the seizure. Now, the keto diet has proven effective over time to help epilepsy, and different research have shown this. Okay, different research have shown this, that it has helped some people over time, reduce seizures. Because again, like I said, it's low in carbohydrates. And so the energy is reduced. The amount of energy that is within the brain is reduced. And so the brain is not able to send as much signals to cause those seizure attacks. So a keto diet is helpful for people who have epilepsy. Um, and then studies have shown that studies have shown that keto diet may reduce how many seizures a person has, or a person with epilepsy has, by more than half after 3 months of starting keto diet. Some people have reported that they are seizure free when they are on this meal plan. Again, it's unique to each person, and that's why they need to be monitored properly. And like I said, the keto diet has its own risk. It has its own side effects. So it's important that you're speaking to your doctor, you're speaking to your dietitian, and they are monitoring you if you are going to be on a keto diet. Now, before a person has epilepsy, or before a child has epilepsy, it is preventable. 25% of those cases is preventable. And how can we prevent this? Let's talk about preventing epilepsy. The first one is preventing any brain or head injury. Preventing head injuries. It's very important that you protect your children from having any head injury, falling down repetitively. Um, don't just say, oh, they fell, they're all right. Make sure you're checking, make sure you're putting in all the necessary precautions. Okay, so preventing head injury is one of them. Preventing head injuries is the first one. The second one is safe childbirth. Safe childbirth and proper prenatal care is very important to avoid and to prevent epilepsy. A third one is controlling blood pressure, controlling your blood pressure, controlling your diabetes, controlling stroke risk. Okay, all of these health conditions, like I've always said, are linked to each other. A person who has high blood pressure that's not controlled, diabetes that's not controlled, then there's stroke, can affect the brain. And another one is preventing brain infections. Like I said, brain infections can affect some part of the brain and cause epilepsy. Okay. Treating fever poorly in children. Treating fever poorly in children. Yeah, that's one. So if a child has fever, please take them to see your provider. Don't just keep giving them medications. Don't self medicate your children just because you think you know that they just need Tylenol because they have fever. If it's continuous, you need to take them to see the doctor. Road safety and helmet use. Again, head injury, brain injury, accidents can cause epileptic seizure. Okay. A moment of just being carefree and not being safe can cause a lifetime of stigma, discrimination, seizures. Okay, so we want to avoid that. And those are some of the things that we can do to prevent, you know, some cases. Now, let's talk about the treatment gap. Like I said, there are treatment gaps, okay? One of the biggest problem of epilepsy is the treatment gap. Okay, globally, it's one of the biggest problems. Okay, about 75% of people in low income countries do not receive treatments for epilepsy. They do not receive the treatment that they need, because if a lot of them can receive treatment, they will be living seizure free. Okay, they will be living seizure free. So imagine that 75% of people in low income countries and even middle income countries globally are not receiving the treatment that they need. In some rural areas, the treatment gap has reached up to 90%. And so people are just living with this thing. They're just living with epilepsy, living with the seizures, and they're not getting the help that they need. Okay. And some of the reasons for this is because they have a shortage of healthcare workers. There's a shortage of healthcare workers. They don't have as much healthcare workers in that environment. Lack of the medicine, the medication that they need. There's a lack of the medication that they need. And that is a big problem, because if they cannot have access to medications, then they cannot manage this condition at all. And people who don't have access to medication can't even have access to surgery. Poverty is a big one. Poverty is a big one. Poverty is, I think poverty is like the main background of this whole thing. When there's poverty, there's no way they can go to the clinic. There's no way they can buy their medications. There's no way they can afford surgery. And so it feels like epilepsy is always going to remain a big issue in low income and middle income countries. Poor access to hospitals, of course. They can afford the hospital. So when they have a seizure, they resolve to maybe going to a native doctor. They resolve to taking herbal medications that are not helping, because again, the society has a notion about this condition. Stigma and the myth behind epilepsy will not let the people that need the treatment get the treatment. Many people still believe that people who have epilepsy are cursed, are possessed, or it's contagious. But that is not the case. Epilepsy is an abnormal electrical activity in the brain. And this is what we want to let people know. It is not that the person is a witch, and it is not that they are possessed, and it is not contagious. It is not a spiritual attack. Okay, so with education, treatment, and compassion, millions of lives can be saved. Treatment can get to people. Now, if you found this video helpful, please like, subscribe, turn on your notification, share this video to create awareness about epilepsy, and let's reduce the stigma around epilepsy. Thank you, and I'll see you in my next video. Bye for now.